Hello, everyone. My name is Terica, and welcome to my channel. I'm a nurse practitioner of over 12 years of experience, and I've worked in several areas of healthcare, including caring for patients living with HIV and AIDS in both hospital and clinical settings. Over time, I've realized something important. It's not that people don't hear about conditions like HIV. It's that no one really has taken the time to break it down in a way that's simple and understandable. And that's what I'm passionate about, helping you truly understand your health and not just hear about it. So let me ask you this. How many of you have heard about HIV, but still feel like you don't fully get it? Because for a lot of people, there's confusion, there's fear, and sometimes there's even misinformation. So today, let's just slow this down and talk about it clearly. HIV stands for human immunodeficiency virus. And what that virus does is it targets your immune system. Specifically, it attacks something called CD4 cells. Now, think of those cells like your body's defense team. They help fight off infections and keep you protected. So when HIV enters the body, it slowly weakens that defense system over a period of time. And I want to say this: HIV today is not what it used to be years ago. With proper treatment today, people living with HIV can live long, healthy lives. So this is not about fear, it's about understanding. So, how is HIV actually transmitted? Good question. HIV is spread through certain body fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. Yep, even breast milk. And for transmission to happen, those fluids have to enter your body. The most common ways HIV is transmitted includes unprotected sexual contact, especially anal sex, sharing needles, and from mother to baby during pregnancy, birth, or breastfeeding. In rare cases, it can also be transmitted through blood transfusions, but that's extremely uncommon today because of the strict screening process. And this part is really important to understand as well. You cannot get HIV from casual contact, such as hugging or shaking hands, sharing food, or being around someone. It doesn't spread that way. So let's talk about this. What happens if someone is diagnosed with HIV? The first step is getting connected to care, because early treatment, it makes a big difference. The main treatment for HIV is called antiretroviral therapy, also known as ART, ART. And what this does is it helps stop the virus from multiplying in the body. So instead of the virus taking over, the medication keeps it under control. And over time, with consistent treatment, the amount of virus in the body can become so low, it's called undetectable. And when it's undetectable, it cannot be passed to others through sex. That's a powerful thing to understand. So if someone is living with HIV, consistency is everything. Staying on your medications, keeping up with your regular checkups, monitoring your labs, and remaining engaged in your care. These are the things that truly make the difference and allow people to live healthy, full lives. And I also want to say this because this is also important. If you are someone you know is diagnosed with HIV, you're not alone. There are real programs and support systems in place to help you navigate through this. One of the main programs is the Ryan White HIV/AIDS program. Through this program, you can receive comprehensive medical care from HIV specialists, access to life saving medications, case management to help coordinate your care, and support services like mental health counseling, transportation to take you to and fro to your doctor's appointments, and housing assistance. Yeah, housing assistance. So this just isn't general help. This is a system built to make sure you're covered, supported, and able to stay in care consistently. But that's not the only option. There are other programs and organizations that also help depending on your situation. For example, there are medication assistance programs through pharmaceutical companies. Programs like Gilead, Advancing Access, that's one. And then we have Vive Connect. V as in Victor, V Connect. These programs can help cover the cost of HIV medications if you qualify. And then there are nonprofit and community-based organizations that provide support beyond just medication. Organizations like the AIDS Healthcare Foundation, the Body.com, and the National Minority AIDS Council. These organizations offer things like education, support groups, case management, and help you navigate your care. And depending on where you live, your local health department or community clinics may also have programs that's available. So the goal is no matter your situation, there are resources to help you get care, stay on treatment, and live a healthy life. So you don't have to figure it out alone. There are resources. Now, let's talk about prevention because there's a lot that can be done. Using protection during sex, like condoms, they reduce the risk. There's also something called PrEP. That's a medication people can take to prevent HIV if they're at higher risk. And then there's PEP, which can be taken after a possible exposure, but it has to be taken quickly. Also, never share needles. And if you're pregnant or planning to be, there are ways to reduce the risk of passing HIV to your baby with proper care. So when you look at all of this that I've given you today, HIV is something we understand much better today. It's manageable, it's treatable, and it's preventable. And I want to say this too. This is not about judgment. This is about awareness, education, and taking care of your health. And I always like to bring it back to this. Taking care of your body matters. The word says in the book of 3 John 1 and 2, Beloved, I pray that you may prosper in all things and be in health. That includes being informed, being proactive, and taking care of yourself with wisdom. And I also believe with God that all things are possible, even healing through Jesus Christ. So if this helped you, go ahead and drop a comment and make sure you like, share, and subscribe.